Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Then miscellaneous drugs. In the miscellaneous drugs, adenosine. Adenosine is a very potent drug and it has short acting. The half life of adenosine is around 10 seconds. So, because of this shorter half life, it is given as IV infusion. It acts upon two receptors, that is A1 and A2 receptors. These adenosine, both these A1 and A2 receptors are G protein coupled receptors, and both these will increase the potassium permeability. Then among these A1 and A2 receptors, A1 is actually a therapeutic receptor which is responsible for the therapeutic effects, whereas A2 is responsible for the side effects. So what does adenosine do? Adenosine is a AV nodal blocker. Then adenosine is actually a drug of choice for paroxysmal supraventricular tachycardia. The drug of choice for paroxysmal supraventricular tachycardia is adenosine. Then what is the treatment of choice for paroxysmal supraventricular tachycardia? The treatment of choice or drug of choice for, it's not treatment actually, the drug of choice for, the drug of choice for prophylaxis. The drug of choice for prophylaxis of paroxysmal supraventricular tachycardia is adenosine. But the normal drug of choice for paroxysmal, sorry, the okay, the drug of choice for acute paroxysmal supraventricular tachycardia is adenosine, but drug of choice for prophylaxis of paroxysmal supraventricular tachycardia, the drug of choice for prophylaxis of paroxysmal supraventricular tachycardia is calcium channel blockers. So, drug of choice for acute paroxysmal supraventricular tachycardia, it is adenosine. Drug of choice for prophylaxis of paroxysmal supraventricular tachycardia is calcium channel blocker, that is especially verapamil is used for prophylaxis. For acute cases, we use adenosine. Then, side effects of adenosine. Adenosine can result in flushing is seen, and also asthma can occur due to adenosine. Then it can result in AV block or heart block can also occur, has the side effects. Then drug interactions. In the drug interactions, first theophylline. If you use theophylline or caffeine, if it is used with adenosine, then this will reduce the efficacy of adenosine. These will cause reduction in efficacy of adenosine. That is, theophylline and caffeine will blunt the effect of adenosine. So these theophylline and caffeine together, we can call it as an adenosine blockers. Then we have dipyridamole. This dipyridamole, this will actually potentiate the adenosine activity. Because it will potentiate the adenosine effect, so we can call this dipyridamole as an adenosine reuptake inhibitor. It is an adenosine reuptake inhibitor. And contraindications of adenosine. Adenosine is actually contraindicated in patients with transplanted heart. If the patient has transplanted heart, then we should not give this adenosine.
thank you and thank you for watching.